to tell us more about what his government is doing to deal with the COVID-19 pandemic. We will listen in now to the Prime Minister of Canada.
I want to start this morning by wishing everyone a happy Sikh Heritage Month. Every day, Sikh Canadians make our cities and our neighbourhoods stronger. And right now, when people need help most, you're stepping up once again. In Regina, you're delivering supplies to your neighbours, while in Mississauga, you're donating to the Siva Food Bank. It just goes to show that we are all stronger together, supporting each other. You are doing your part, and so many others are doing the same.
To the people on the front line, thank you. To our farmers and truckers, to the people delivering air cargo, to nurses and doctors. You are working 24/7 so that we can eat and take our medications. You are protecting our health and the health of our families. Your government is there for you. And we all say thank you.
Our government has introduced a 3-point economic plan to protect jobs, help people laid off, and support businesses. If you're worried about your job, we're helping your employer keep you on the payroll with the Canada Emergency Wage Subsidy. Later today, Minister Morneau, Minister Ng, and Minister Baines will provide an update about this 75% wage subsidy. But what I can say now is that it's going to be available for businesses, big and small, that are not publicly funded and have seen a 30% or more decline in gross revenues. That includes everything from bars and restaurants to charities and nonprofits. Applications will soon open through the CRA. Like I said on Friday, this money is for workers. Employers will need to attest that they're doing everything they can to pay the remaining 25% of people's wages. These are unprecedented times and will require us to pull together as a country and trust each other as Canadians. So there will be stiff and severe penalties for trying to take advantage of this system and of your fellow Canadians. Notre subvention salariale de 75% est là pour les entreprises petites et grandes.
Wage subsidy is there for small and large companies that are not publicly funded and have seen a 30% decline in their revenues. That includes restaurants and bars, charities, and nonprofits. You will soon be able to apply on the CRA website. That money is for workers. Employers that use that subsidy have to do everything in their power to pay the remaining 25% of workers' wages. As I've said, we are in an unprecedented situation. We have to pull together as a country and trust each other. There will be very stiff and severe penalties for anyone who tries to take advantage of the system and fellow Canadians.
So we're taking unprecedented action. And while we put this measure in place, we're continuing to move forward on the other two prongs of our economic plan. To help business owners worried about rent or other bills, we've brought in new loans. And to help people who lose their paycheck, whether they're freelance or have been laid off, we created the Canada Emergency Response Benefit. And on that front, I have some good news to share.
Starting on April 6th, if you have not yet applied for employment insurance, you can apply online to receive the Canada Emergency Response Benefit. That is available to everyone. But if you are receiving the wage subsidy, you cannot receive the Emergency Response Benefit. You can apply by visiting canada.ca. And when you apply, you will have the choice of receiving your benefit by mail or by direct deposit. After that, all you'll have to do is to confirm that you are still without a job once every month. But again, if you have already applied for employment insurance, you do not need to register starting on April 6th. We are also taking measures to prevent the system to be overloaded by applications. Later today, Minister Duclos and and Minister Qualtrough will have more details to share with respect to the process and eligibility criteria.
Starting April 6th, you'll be able to apply for the Canada Emergency Response Benefit. A reminder, if you're getting the wage subsidy from your employer, you can't collect the CERB. It's one or the other. You can't get both of these benefits. For the CERB, you can register online at canada.ca. By selecting direct deposit, you should receive your payment within 3 to 5 days. If you can't apply online, don't worry. You can call the Revenue Agency for help over the phone. By mail, you'll get your check within 10 days. After applying, all you need to do is keep getting this benefit is check in every month to say that you're still out of work. And if you've already applied through EI, you're all set up. You don't need to do anything on April 6th. We're putting measures in place so we don't overload the system, but I can assure you that everyone will get their money. Later today, Minister Duclos and Minister Qualtrough will have more details on this whole process, from eligibility to applying to getting your check. But the bottom line is this: we're getting you the help you need when you need it. We have a plan to protect jobs, to help those who've been laid off, and to support businesses that are having cash flow problems. And we're not done yet. We're going to keep working hard to make sure you're getting the support you need. This is the largest economic program in Canada's history. So I've asked the House Leader and the Deputy Minister to reach out to the other parties about bringing back Parliament. This must be a Team Canada effort. Governments of all orders across the country are stepping up to fulfill their responsibilities to Canadians. Canada hasn't seen this type of civic mobilization since the Second World War. These are the biggest economic measures in our lifetimes to defeat a threat to our health. These historic measures will support Canadians to stay home to defeat COVID-19. But the government alone cannot win this fight. We all have to answer the call of duty. This is service that most of us have never been called upon to do. We, each of us, have to live up to our end of the bargain. We must fulfill our collective responsibility to each other. Listening to public health rules is your duty. Staying home is your way to serve. So be smart about what you do, about the choices you make. That is how you will serve your country and how we will all serve each other. How well we do this right now determines where our country will be in 2 weeks or in 2 months. It's in our hands. It's in your hands. On a tous un rôle à jouer.
We all have a role to play.
On a une responsabilité collective.
We have a collective responsibility. Where we are in a few weeks or a few months does not depend on me, but on you. I am calling on your civic duty to protect others. If you do not follow the public health guidelines, you're putting others at risk. You all have a moral obligation to remain home. We all have a moral obligation to take care of each other. It is by working together that we will come out of this. It is by remaining true to our values that we will stay who we are as Canadians. Thank you.
Thank you. We'll now go to the phone line for one question and one follow-up. Operator.
Thank you. Merci. Première question, Michel Lamarche, TVA Nouvelle. À vous.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. This morning, do you consider that part of your responsibility is to be transparent about supplies of equipment? Can you guarantee us that there will be no shortage of PPE? The ministers were unable to do that yesterday. In this situation, we cannot guarantee anything. We are working very, very hard to try and meet the various needs, to ensure that the necessary protective equipment is delivered right across the country, and we are developing solutions right here in Canada to replace the equipment we use every single day in order to keep our healthcare professionals healthy. We will continue to work with the provinces and the various jurisdictions to meet all of their needs. But much of that depends on the choices that Canadians make now, how people behave today and in the coming weeks, and the choices that they make in terms of keeping this pandemic under control and being able to continue to protect the people who are working to protect us.
Follow up, Michelle?
There is a pressing need for surgical masks in Quebec. You heard that. Can you tell Quebecers or Quebec that your way of resolving this is to transfer part of the federal supply to Quebec? Yes, absolutely. The federal stockpile is there to help Canadians where they need help. I have spoken directly to Premier Legault. He pointed out the challenges that they're facing in Quebec at this time, and we will be there to work very hard to meet their needs. We are expecting shipments of PPE very soon, and we will be getting more as well. And we are going to be working on the resources to be made available here in Canada, and we will make sure there is no shortage in Canada. But of course, we understand it's a very difficult situation, and we will all have to do our part.
Thank you. Next question, operator.
Thank you. Merci. Next question, Mia Rabson, the Canadian Press. Your line is open.
Good morning. I'm wondering if you could explain why the National Emergency Stockpile didn't seem to help keep the equipment in the hands of health workers that we needed, and whether or not we're going to use the Defense Production Act in order to fill the need.
The Defense Production Act that we've seen in the United States is about forcing and ordering companies who might not otherwise do it to step up and produce the necessary equipment for a wartime or crisis situation. Here in Canada, what we've seen is companies across this country putting up their hands and asking to do it, offering any help they can right across the country to switch their manufacturing over to necessary goods, necessary equipment. We so far have seen such an overwhelming response from businesses that we have no need of bringing in at this point a similar act. But of course, we'll always keep an eye on what we need to do in future situations or how we can adjust. And the federal stockpile has been ensuring over the past weeks that there is enough equipment across the country to respond to the needs that the provinces have asked us for. On a vu que aux États-Unis ils ont
In the United States, they did decide to bring in the Defense Production Act. But in Canada, I can tell you that we have no need at this time to do that, because Canadian manufacturers and businesses across the country and plants all across the country have all been volunteering to help us to switch their processes to manufacture what we need. Now, of course, if we find we have a need to do that later on, we will do so. But for now, I can only thank all the different companies that have stepped up and offered to help us and who are working very hard to help their fellow citizens.
Follow up, Mia?
Yeah, I'm wondering if you could let us know what assurances you have from the Americans that they've dropped the idea of moving troops towards the U.S.-Canada border.
The ongoing conversations we have with the American administration continue on a broad range of subjects, and we have heard that is not something they're continuing to pursue, but we will, of course, continue to engage with the American administration as new situations come up and as things develop.
I can tell you that we continue to regularly speak to the U.S. administration on issues involving our border and critical trade between our two countries. For the time being, we have heard that they do not intend to pursue that idea, but we continue to have discussions with them.
Operator, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci. Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. There is a shortage of medical equipment in Quebec, or there will be soon. How will the government help Quebec to resolve this problem? To reassure the Quebec medical professionals. Well, we are currently working very hard with the other provinces to see what options are there to help Quebec and any other regions who are in need of equipment, but we're also working at the international level to try and ensure that we can bring in additional equipment. For example, our ambassador in China is working diligently to follow up on this and get the material in that we have ordered. But the fact is that there are many, many countries that are running after the same equipment. And we are working hard and doing everything we can to ensure that nowhere in Canada will there be a shortage of PPE. But there's still a lot of work to be done. Can you tell me whether this will happen before the end of the week? And on another topic, Mr. Trudeau, there's a government document where it says that the current measures will have to last until July or August. I can tell you that we are expecting to receive deliveries in a very short time frame, in the next few days or perhaps even sooner. And when it comes to scenarios, as I have said very often, we are looking at all sorts of different scenarios. It could last longer, it could last less time, and as I've always said, that will really depend on the choices and the behavior of Canadians every single day. How we keep ourselves safe, how we keep everyone else safe, the choices we're making, all of that has a direct impact on how long this is going to last. But looking around the world, even in countries like South Korea, where they were able to manage the crisis fairly well, those measures remain in place for a long time. And I think people have to expect that we will be facing this for many, many weeks to come, if not months.
Thank you. And one more question on the phone, please, operator.
Thank you. Merci. Next question, Eric Atkins, The Globe and Mail. Your line is open.
Hi there. Thank you. Given that Canadians returning from abroad are bringing confirmed cases of COVID-19 into Canada as recently as a few days ago, why are airlines and the government still bringing Canadians home?
That is a good but a difficult question. In Canada, we understand how important it is to keep Canadians safe. And we hope and are demanding that those Canadians who do return home self-isolate for 2 weeks. I know there are countries that have decided that people overseas or people elsewhere are not allowed to come home to Canada. That is not a choice we've made. We want Canadians to come home, but we also very much expect and demand that they keep themselves and their neighbors safe by self-isolating in rigorous conditions for 2 weeks as soon as they get home. We would much rather be able to have people home than have them stranded elsewhere around the world where things are getting, worse. Okay.
As a country, we made the decision to ask Canadians or to offer Canadians the possibility of coming back home if they're abroad. This is not the decision that other countries made. There are some countries or the citizens of other countries that are unable to go home, but we decided to bring home all Canadians because it's important for Canadians to be able to get back home where they are safer. At the same time, we have brought in very strict and rigorous measures so that people coming back will not put others at risk, their neighbors, our healthcare workers, and so on. That's why it's so important that whoever is coming back to Canada from travel abroad self-isolate for 14 days to keep us all safe and to keep our healthcare workers safe.
And one follow-up.
I'm just wondering what the public health case is for allowing any Canadian to return.
The public health case is that if people who return properly and rigorously self-isolate, then we are not significantly increasing the risk to everyone else. It requires ensuring that they do indeed self-isolate, but in Canada, we try to look out for each other. That's been the characteristic of what we've seen over these past weeks. As people are there to help each other, people are making choices to make sure that they don't put themselves, their families, or their neighbors at risk. We see neighbors ensuring that food is dropped off to people who can't go out or are too vulnerable. We've seen volunteerism up extraordinarily, people calling up to volunteer as crisis counselors to go through the rigorous training to volunteer at Kids Help Phone. Canadians help each other when we're in tough times. And part of helping each other in tough times is making sure that Canadians who are stuck overseas can come home. But part of that responsibility that they have then is to make sure that they're not putting others at risk and make sure that they self-isolate.
Prime Minister Kevin Gallagher with CTV National News. Toronto's Chief Public Health Officer indicated today that these public health measures to mitigate the spread of COVID-19 could be in place for 12 weeks. There are, according to the National Post, internal federal government documents that also indicate these measures will be in place until July. You yourself have not shared these types of projections. Don't Canadians have a right to know how long these important yet disruptive public health measures will be in place for so that businesses can plan and families can plan?
We have been open and transparent with Canadians on the facts, and I've said from the very beginning that there are a wide range of scenarios that we have been looking for, that we're planning for, that we are trying to work towards as a government, as a country. We know that we are going to be in place for a number of more weeks, perhaps more months, but everything depends on how Canadians behave. The choices you make to stay at home, to self-isolate, to not go to 6 different stores when you go grocery shopping, to try to go grocery shopping only once a week, to be very careful to keep those 2 meters apart when you go for a walk, if you're allowed to go for a walk. These sorts of things are what will arrest the spread and the increase of this virus. We need all of us to do the best we can to make it through this unprecedented situation, and that's exactly what Canadians are doing. Okay.
We recognize that it has been important every step of the way to be open with Canadians, and that's why we've been saying it could last for weeks or even months. At the same time, there are a range of different scenarios that we're looking at and for which we are preparing. But the critical thing here is Canadians' behavior. If Canadians make the right choice, if they decide to stay home as much as possible, if they keep a safe distance of at least 2 meters from others, if they try not to go to 8 different stores when they go out to buy food once a week, the choices that we are making and our behavior at this time will have a direct impact on where we're going to be in a few weeks and a few months. That's why we are here to support families and individuals, businesses. We are here to keep our economy stable while it is practically at a standstill so that we can recover quickly when we are able to. But that when is something we will know only in time. And as I said, it depends on the choices we make now.
Rather startling death projection released in the United States. Is there a similar projection in Canada? And if so, why have we not heard about these sorts of details?
As we've said, there are a range of projections depending on how Canadians are behaving, how isolation is working. I can say right now that the fact that so many Canadians are behaving in the right ways, are choosing to stay home, are choosing to self-isolate, are choosing to stay in their bubble, as Dr. Tam says, are choosing to not endanger themselves or their loved ones or their neighbors or our healthcare workers, is an extremely good sign. We are, of course, watching very, very carefully as the numbers creep up, as they arise more rapidly in different areas. And we will take the measures necessary to do everything we can to keep Canadians safe.
Louis Blouin, Radio-Canada.
Mr. Trudeau, there are people who are home right now and they hear you say this may last weeks or months. There's a great deal of uncertainty and people are worried. Is it possible to have more specific information so that people are able to plan their lives over the next few weeks? Can we say to people that July is a realistic scenario? It may not happen, but it's a realistic scenario? Well, I can say it is a realistic scenario, but there are other shorter scenarios. There are other longer ones as well. We do not know. We know that we're trying to control the spread and flatten the curve, but it does not depend on a government. It depends on all citizens. And we are preparing and looking at a whole range of possibilities. It is possible that it will last a few weeks. It's possible it will last a few months. We will do whatever we need to do. First of all, two things. We will do everything we can to keep people healthy and also ensure that we have the ability to come out of this so that all Canadians have the resources that they need to remain in isolation as long as they have to. Mr. Scheer this morning proposed that the GST collected from businesses over the last 6 months be refunded to them. What do you think of that idea? Is that on the table? Well, there are all kinds of ideas coming forward from various sources, and we're open to any proposal, and we'll look at everything. Now, in terms of aid for businesses and particularly for workers, what we put on the table thus far are measures that represent the largest and the most unprecedented program in our history. This will help workers, this will help businesses, and there will probably be more that has to be done, and we will be there listening and looking at what we can do. We're always open to any suggestion, and I want to thank everyone who's making proposals. If that can help Canadians to come through this crisis so that we can recover and get back on our feet more quickly at the end.
With CBC News. You've been talking about the efforts your government's making to procure medical equipment, protective gear, and yet frontline health workers are still talking about shortages. So why is there this disconnect between the assurances you're offering and what frontline healthcare workers are experiencing?
We recognize the challenges that frontline health workers are facing in different parts of the country. We are working very closely with the provincial authorities in charge of those healthcare systems to try and meet the needs that they're faced with. We are looking at a global demand for these supplies that is unprecedented. Countries around the world are trying to get more of these supplies. We are expecting to see some shipments coming in very shortly that will help in Canada. We're continuing to work on more shipments in the coming weeks. And we are also working on tooling up our own production so that we can have made-in-Canada solutions for the coming weeks and perhaps months, if that's how long this lasts. We are doing everything we can to meet the very real and pressing needs that we have in our healthcare system right across the country, particularly in some areas. And all I can say is that we will continue to work extremely hard to try and solve this problem, because we need our healthcare systems and our healthcare workers specifically to have the protection they need as they keep the rest of us safe.
The Premier of Quebec was talking yesterday about supplies running out in 3 to 7 days. We've seen shortages in Ontario as well. So have you spoken specifically to those two provinces and offered them aid at this time?
We are offering all the help that we possibly can to all provinces, particularly Ontario and Quebec, that are facing difficult situations in terms of supplies. I can tell you that we are going to be receiving a shipment very soon of necessary equipment, and there are more to come in the coming days and weeks as well. We will continue to do everything we can to make sure that our healthcare workers get the support they need to be able to keep us safe. And we also, as I spoke about yesterday, have manufacturers stepping up so that we can have made-in-Canada solutions, and we're not reliant on other countries as the world is looking for more PPE.
Prime Minister Janet Silver, Global News. The scientific literature is fairly clear on how mask use by the public can help cut the spread of influenza during a pandemic. And some countries are now making mask use mandatory across the board. Yet in Canada, the suggestion is that mask use won't really make a difference if you're asymptomatic. I'm wondering how much of a decision is based on the government wanting to make sure the public doesn't take masks away from healthcare workers at a time when there is a shortage.
Yeah, I think every decision we take needs to be based on the recommendations of our best science officials, who are looking at everything from protection of Canadians to making sure we're protecting our healthcare workers. And on this issue that I know is an ongoing conversation amongst professionals and health professionals around the world, we are going to defer to our Chief Medical Officer, Dr. Tam.
But with all due respect, Prime Minister, if there are dissenting opinions in the international scientific and medical community on wearing masks for the public, if they are asymptomatics, do we not then owe it to the public to put whatever protective measures in place to protect them?
I'm going to continue to defer to Dr. Tam on this issue. I know there's much discussion going on that, and we certainly want to take the right decisions to make sure that Canadians are protected and that our healthcare workers are protected. Merci beaucoup tout le monde. Bonne journée.
We now join the following program in progress.